Public health officials in Toronto are concerned a solution to one disease is leading to a rise of several others. Truvada is seen as a revolutionary drug in the prevention of HIV, but it may be providing a false sense of security. The CBC's Philippe de Montigny explains.
Stephen Lowe and his longtime partner take a little blue pill every morning. Pre-exposure prophylaxis, or PrEP, allows them to have sex with other men without the fear of contracting HIV.
They could think they're negative but not be, or they could, be positive. Now the power is all in my hands with this pill.
Approved by Health Canada a year ago, PrEP is 99% effective when taken daily, but it doesn't ward off other sexually transmitted infections.
A lot of people attempt to use it as some sort of cure-all, and it's not quite that.
Yet, a number of PrEP users on apps like Scruff or Grindr say they actively look for bareback or unprotected sex. But it's not just in Toronto. Big cities like Montreal, San Francisco, and New York also see the trend. Toronto Public Health worries the drug provides a false sense of invincibility for some users.
Because they may not be using condoms. Once the risk of HIV is eliminated, people may be less likely to use condoms.
Toronto Public Health data obtained and analyzed by CBC News reveal an upward trend in STIs like syphilis, gonorrhea, and chlamydia when comparing the period following PrEP's approval in 2016 to the same period in 2013. And last year, 9 out of 10 syphilis cases reported involved men who have sex with men. But pharmacist Michael Fannis says PrEP isn't to blame, as patients who take it are required to test for HIV and other STIs every 3 months.
And we know that if you test more frequently, you'll have more positive test results.
He says the frequent checkups could actually reduce the spread of STIs in the long run, as they're detected and treated more quickly among the highest risk patients. But PrEP is still inaccessible for many Canadians. It costs about $1,000 a month, and Quebec's provincial drug plan is the only one in Canada that covers it. Some Ontarians like Fannis are calling on the government to step up.
The next step is to sit down. If it's seen as effective and approved, then we sit down with the drug company and negotiate the price, which can take a few weeks or it can take a few months.
But the minister hasn't even started that negotiation process, even though the Pan-Canadian Drug Review Committee recommended nearly 7 months ago that provinces foot the bill for PrEP. Philippe de Montigny, CBC News, Toronto.